Hello, Assalamualaikum.
Assalamualaikum warahmatullahi wabarakatuh.
My name is Muhammad Hazim.
My name is Muhammad Haris bin Muhammad Safi'i.
My name is Hasanah Balkis.
My name is Saiful Azwa.
My name is Farhan Adi Birazwan.
For this video,
We would like to talk about
The Sustainable Development Goal Tier 3.
Which is good health and well-being. In this day and age, pills, injections and sophisticated treatments can save us from a flood of illness and injuries that may lead to an inevitable death. Such treatments can also protect us from countless of daily pains and ills that the pre-modern individual have come to accept as part of life. Each day, 17,000 less children die than in 1990. Since the year 2000, measles vaccines has prevented approximately 15.6 million deaths around the globe.
however, in the same universe, more than 6 million children continue to die every year before their 5th birthday. Despite global progress, a growing proportion of child death still occurs in sub-Saharan Africa and South Asia. 4 out of 5 deaths of child under 5 occurs in these regions. The rate of maternal mortality, which is the proportion of mothers who do not survive childbirth, is still 14 times higher in developing regions than in the developed ones. Only half of women in developing regions receive the recommended amount of medical care.
In SDG Goal 3, it has several goals and priorities, which are: first is reduce mortality rates, second, end epidemics, third, increase disease prevention, fourth, achieve universal health coverage, fifth, support vaccine development, sixth, improve training of health, and the last but not least, professionals in developing countries.
Hence, the enhancement of information accessibility and knowledge distribution is an important part of SDG Goal 3. In an AI age, data is powered with potential to become the main medicine in the fight of prevention of diseases. AI technology has the potential to transform health services and systems. Big data and artificial intelligence can open possibilities for remote care and mobile health to significantly change the practice of medicine and create new forms of medical care.
Sustainable Development Goal number 3 aspires to ensure health and well-being for all, including the bold commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030. Despite this incredible progress, AIDS is the leading cause of death among adolescents in sub-Saharan Africa, and 22 million people living with HIV are not accessing life-saving antiretroviral therapy.
Health impacts of the environment, including hazardous chemicals, pollution, and climate change. Pollution, chemical exposure, climate change, and ultraviolet radiation contribute to more than 100 diseases affecting primarily young children and elder people. According to the World Health Organization, environmental risks take their greatest toll on young children and older people. The report finds that children under 5 and adults aged 50 to 75 years most impacted.
The next problem is the current international poverty line is $1.90 a day, and people in low-income countries earn about $1.91, which is barely enough for them to be able to go feed their families. In developing countries, many people are living under the poverty line, which makes it very difficult for these people to be able to go to the doctors to get any sorts of treatments and medicines. For example, if a farmer from Africa had to pay for an MRI scan that costs between $300 and $700, they will not be able to afford it.
Next, in developing countries, people are not educated about the importance of sanitation and hygiene, which is what allows for the spread of different diseases. Every 1 in 4 children will never read or write, which make 20% of the population of these developing countries illiterate. People will not be educated about the effects of drinking contaminated water or eating contaminated food. This also increases the spread of many infectious diseases into the home and in the community.
Over 15,000 children die every day. Child mortality is an everyday tragedy of enormous scale that rarely makes the headline on the news. Child mortality rates have declined in all world regions, but the world is not on track to reach the Sustainable Development Goal for child mortality. Goal 3 is to reduce the child mortality rate to at least as low as 2.5% in all countries by 2030. This would mean that more than 97.5% of all newborns would survive the first 5 years of their life no matter where they are born. Unfortunately, we are currently far away from the goal for 2030.
Innovative treatments for a complex disease such as the cure for a cancer, genetic manipulation, operating robots and bionic limbs. For most of us, this is not yet a reality, but it is not one difficult to imagine. In health system, the benefits of AI can be numerous, from improved timeliness and accuracy in diagnosis to simplified disease monitoring and surveillance. AI enables quick responses in emergencies as a fundamental in distance and adapted learning.
On the other hand, AI could be a replacement for doctors. By using a field in AI called natural language processing, we can create AI that is able to talk in English to any person by chat. They are also known as chatbots. I personally think that this is a very brilliant idea and also important for our world nowadays, because people are able to access internet almost everywhere, as they are able to get access to a chatbot too that is more effective, efficient, and does not cost any money.
Other examples include the provision of services such as home monitoring and regular communication with patients. AI done diligently can enable patient access to information and ability to manage their chronic condition. It can also ensure that the general public has access to timely and efficient advice through a smartphone in health emergencies.
AI can be implemented to diagnose disease early on so that you have a higher chance of survival. For example, an early stage cancer detection will increase the chance of survival than detection at a later stage. This can not only be implemented with every kind of disease, but people that live in developing countries could use AI to have a better accuracy at detecting disease, better than a top doctor. AI will be able to detect most diseases as it can learn to find patterns between the disease and some of the symptoms, because AI can replicate experts' behaviors to save time and energy.
And last but not least, to reach SDG number 3, we need to ensure that the benefit of the new technologies, especially information and communication technologies, are available to everyone. AI here must capture the attention of both the public and the private sector towards this greater cause in a decentralized environment.
To summarize, evaluating risk is the first step towards ensuring that the advantages of AI advancements are fair and long-term. Only by understanding these flaws will we have the capability and knowledge to develop kinder and more sustainable AI technology in the future.
We also believe that AI will play a significant role in future healthcare products. It is the key capability supporting the development of medicines, which is always acknowledged as a much-needed advancement in care.
If AI is used correctly, it can provide patients with access to knowledge and the ability to manage their chronic illnesses. In health situations, it can also ensure that the general public has access to fast and efficient guidance via a smartphone.
Furthermore, AI improves healthcare providers' ability to better understand the day-to-day patterns and requirements of the individuals they care for, allowing them to provide greater feedback, guidance and support to help them stay healthy.
That's all from us. Thank you for watching.